Hi everyone. I am Dr. Devendra Paliwal, orthopedic surgeon from Nanded, Maharashtra. I had been practicing orthopedics since last 26 years at Nanded. I am basically an trauma and spine surgeon. So today I would be speaking about something about musculoskeletal health. As you all know that musculoskeletal health plays a key role to keep us in good mobility and dexterity in an individual, along with enhancing the ability to work and actively participate in all aspects of life. Good musculoskeletal health is also crucial to maintain economic, social, and functional independence across life course. So, physical activity has a crucial role in reducing the risk of other non communicable diseases, and it can only be achieved with adequate musculoskeletal health. So, to begin with, impaired musculoskeletal health can lead to acute and chronic pain, causing physical limitations, proceeding in loss of participation and withdrawal from usual social, community, and occupational activities, further decreasing the quality of life well being, including mental well being. Impaired musculoskeletal health can lead to substantial personal, community, and social consequences, particularly in older patients. A strong relationship between painful musculoskeletal conditions, lack of physical activity, and resulting functional decline, virility, loss of well being, and loss of independence, as well as depressive symptoms, have been described by severe epidemiological studies. An individual with arthritis and musculoskeletal disorders is sure to be lesser active than an individual without arthritis. Thus, a lack of regular physical activity emerges as the most prevalent risk factor associated with functional decline. Most importantly, impaired musculoskeletal health causing reduced physical capability like grip strength, walking speed, chair raising, and standing balance has been frequently linked to increased mortality. Thus, weak musculoskeletal health is a key component of frailty. The impact of impaired musculoskeletal health is now recognized globally, with an increase in morbidity and mortality related to it. Good musculoskeletal health is crucial for maintaining an active, productive, and prolonged working life. With an increase in the global retirement age, maintaining good musculoskeletal health will become increasingly important for older workers, as many occupations and work related activities are associated with musculoskeletal disorders like low back pain, shoulder disorder. Thus, it is important to identify and implement effective interventions for people with musculoskeletal conditions to remain productive at work. High income countries observe musculoskeletal conditions to be one of the major causes of work loss, early retirement, and loss in retirement wealth. While developing countries see musculoskeletal conditions to have a major impact on livelihood, thus reduces musculoskeletal health results in reduced productivity and economic loss to society at all levels. Since musculoskeletal conditions are chronic, painful, associated with disability and social disengagement, frequently causes mental health impairments such as depression and anxiety, as well as other comorbidities. Physical and mental aspects of quality of life related to health is known to be greatly impacted in persons with multi-morbidity. Unfortunately, this impact is even greater when there is an associated musculoskeletal condition. Non-communicable diseases now account for most of the global burdens of diseases, with musculoskeletal conditions being the leading contributor. Developed countries well recognize the transition of burden to long-term disabling conditions. However, now low and middle income countries are also demonstrating the enormous future impact from musculoskeletal conditions, such as osteoporosis and low back pain deriving by population growth and aging. Since age is the commonest risk factor for musculoskeletal condition, it is estimated by 2050 there will be a 5 times rise in the people over 40 years living in developing countries, contrasting the wealthier country. The World Bank says accordingly in 2011. Additionally, obesity, another important risk factor for many musculoskeletal conditions, is also hypothesized to rise dramatically in the developing world over the coming 2 decades. Furthermore, increasing use of motor vehicle is not only reducing physical activity, but also increasing the number of motor vehicle accident and resulting in musculoskeletal trauma and disorder. Sustained and systemic urbanization in developed countries has led to sedentary behavior among the people, particularly young ones. The rapid growth of legions of video games, social media, movie streaming, and binge watching seems to be the prime contributor. This surge in sedentary behavior is not only a major risk factor for many chronic diseases, but is also recognized as a substantial global economic burden. Increasing physical activity and optimizing exercise as recommended by arthritis research of the WHO is an optimal way to improve musculoskeletal health. Evidence show that the effects of a sedentary lifestyle, for example, desk jobs can reduce by a small amount of activity every day. A recent meta-analysis utilizing the data of 1 million individuals concluded that 1 hour of moderate level activity daily can eliminate the increased risk of death associated with 8 hours of sitting. Thus, a moderate level of physical activity remains a key requirement for healthy aging and maintaining musculoskeletal health. Sedentary behavior is a major contributor to obesity and type 2 diabetes. Likewise, obesity also is a major contributor to the development and progression of osteoarthritis, with severe epidemiological studies confirming the link between adiposity and joint degeneration. Evidence suggests that increasing the level of physical activity will not only increase musculoskeletal health, but also decrease the risk suffering from obesity-related diseases such as diabetes. Nearly 2 hours per week of moderate physical activity, or about, say, 20 minutes per day of any kind of physical activity like brisk walking, is recommended by WHO. These exercises elevate heart rate and are known to be associated with lower lifetime risk of cardiovascular diseases. Apart from rendering musculoskeletal health benefits, improvements in cardiorespiratory fitness can be achieved by changing sedentary behavior to achieve a low-intensity physical activity like walking. Exercise is now widely prescribed for the rehabilitation of musculoskeletal injuries, and its use as a preventive health measure is now widely investigated with guidelines around the time. Frequency and duration of activity being considered. Low back pain and neck pain can be benefited by staying active and exercise regularly. Group exercises programs or weight loss support can be considered. To reduce the incidence of falls, balance, and strength training, home hazard assessment, participation in falls prevention programs are getting involved in activities like gardening, dancing, etc. This helps. Osteoarthritis has been shown to be benefited from activities and exercises that improve muscle and aerobic fitness, like walking, swimming, pilates, weight loss can be rendered if required. Aging is inescapable, but it can be made easy and healthy with the help of exercises. Exercises render many benefits to the aging body, including reducing the manifestation of aging, especially the aging phenotype of the elderly. A recent systematic review concludes that physical exercise renders a positive impact on muscle and functions in healthy subjects aged 60 and above by improving muscle performance and by increasing the ratio of type 1 and type 2 muscle fibers and increasing the cross-sectional area of its muscle fiber. European Society for Clinical and Economic Aspects of Osteoporosis, Osteoarthritis, and Musculoskeletal Diseases Task Force recommended higher protein intake in combination with physical exercise in postmenopausal women at risk of developing a menopausal associated musculoskeletal diseases like osteoporosis. Physical exercises program improves strength and balance in aging women with osteoporosis. Additionally, fragility fracture risk associated with osteoporosis can be decreased by following an exercise program, and exercise increases bone density and reduces inflammatory markers also. Thus, having an active lifestyle from an early age and following recommendations for exercise could be beneficial for women also. Exercises and mechanical loading also have a positive impact on the molecular, cellular, and tissue levels. Like with aging, the potential for cell proliferation and the number of stem cells decreases in tendon. Exercises loading can induce an increase in tendon collagen synthesis, thus increasing tendon strength. Physical exercises and mechanical loading also have a positive role in maintaining cartilage and bone health. Moderate exercises could also enhance the quality of tissue products during the healing of injured tendons. A surge in sedentary behavior and unhealthy diets have caused a global obesity epidemic, along with a sharp rise in the incidence of type 2 diabetes. These are further great risks from cardiovascular and and neurodegenerative diseases, which further complicate the management of musculoskeletal disease. Obesity is an important comorbidity of many musculoskeletal conditions and is closely related to the development of osteoarthritis, one of the commonest musculoskeletal issues. Thus, strategies aimed at reducing obesity in adults will reduce the occurrence of osteoarthritis and thus can alleviate some of the pains of the conditions. Interestingly, obesity is also one of the most modifiable risk factors for osteoarthritis. Exercise and weight loss have benefited overweight and obese adults with knee osteoarthritis in many clinical trials. Thus, combining modest weight loss with moderate exercises can provide the best overall improvement in systems of pain and joint function. Lack of physical exercises in childhood causes childhood obesity, which further leads to musculoskeletal pain in later life. Thus, reducing obesity in children by encouraging physical activity will also reduce the risk of developing musculoskeletal pain later in life. Furthermore, consumption of an unhealthy diet and sedentary lifestyle is contributing to the increasing incidence of childhood obesity. Low in nutrition value and high in caloric content food further contribute to the obesity epidemic, which may also play a role in high prevalence of type 2 diabetes and cardiovascular diseases, which are further exacerbated by lack of fitness and by inactivity. Yes, diet is inevitably important part of healthy living. A 3-year follow-up study, including about 400 adults, showed that diet high in potassium, which we get from fruit and vegetable intake, reduces the amount of muscle loss in adults more than 65 years of age. Dietary food for diet which would, if you consume fruits and vegetable, is also known to be positively correlated with good bone health. That it increases the bone mineral density and bone resorption in perimenopausal women. Improving the diet of osteoarthritic patients have also shown great benefits. Vitamin D, calcium, and particularly protein consumptions have been shown to optimize muscle, bone, and functional outcome in older people, reducing fall and fractures. Calcium and protein synergistically optimize bone health. Thus, dietary strategies for improving musculoskeletal health should include consumption of long-chain fatty acids, vitamin D and K, and decreasing blood cholesterol. Antioxidant-rich diet may benefit athletes by improving tissue repair. Sarcopenia in elderly can be benefited by combining exercise with a dietary supplement of whey protein fortified with vitamin D, as it increases muscle and strength mass. So this is in short which I could express myself for the musculoskeletal strengthening in an adult individuals, which has to be followed. And thank you very much.